it's been FDA approved in treatment-resistant depression since 2018. And it's also used in various other conditions, off-label use, including anxiety, bipolar depression, PTSD, addiction, chronic pain or migraines. I've even heard of this lady, she was having tremendous pain from Lyme disease, and she was able to use ketamine, long infusions, I think at least 4 hours, and it was tremendous in helping her with pain. So this medication, it's, one of the benefits is that it can, promotes this overall repair capability for the brain because it's increased brain-derived neurotropic factor secretion. So it helps to repair the neurogenesis. So this is what's, fairly revolutionary comparing to what we're looking at in traditional antidepressants. And it, promotes regeneration of the neurons, dendritic spine formation, and has anti-inflammatory action. So I know one of the clinical studies actually utilized ketamine in the treatment of COVID. So it's very interesting that it has wide range of uses. And it also, one thing that no one has mentioned and talked about, which is how it changes the brain waves. So I think we're so focused on just receptors. I think the entire medical community has been so set and fixated on receptors and receptors. And if you look at the board of all the receptors of how ketamine works, there are about 50, 60 things on there that each one is linked to another, and they can increase and decrease and modulate, and you just become, this web of complex and convoluted and confusing relationships. So I think what we need to look a little bit beyond receptors is what kind of a global effect ketamine can exert. So what they found out is that it actually changes your brainwaves. When they compared people under ketamine to people who are long-term meditators, like the Tibetan high monks that have been meditating for 30 years in their lives, and they look at their brainwaves, these high monks have high gamma wave activity, and that's what's happening under ketamine as well. The gamma waves. I think we still are not understanding enough of exactly what's going on there. So I think receptors is one aspect, but the brain waves and what's happening in that state is a whole other story. We still don't understand why meditation can promote such dramatic benefit in a person's wellness and healing. So what's going on there? Why are these brain states causing, leading to that kind of healing? So by the same token, if ketamine can promote something similar, what's going on there? I think we don't know either. So there are a lot of things we don't know. So when we're looking at this medication, it's very, very safe. It's non-addictive in clinical settings. There are people abusing it, of course, and that's one of the first things that people ask, oh, is this the one that, isn't that a street drug or isn't a horse tranquilizer? Yes, there are a lot of people who are abusing it, who are snorting it, which is a whole different experience compared to using it in a clinical setting and using the IV infusion. And yes, they do use that to tranquilize animals, wild animals, or pediatric, little animals, little patients, and it's extraordinarily safe. So I actually utilize that to help some of the autistic patients I see, when I need to do procedures. So very safe. And just to look at something extraordinary about ketamine. For people with major depression, which is a devastating condition, 30% of them actually don't get any healing from the traditional antidepressants. Whereas if you start using ketamine, 50 to 70% of these treatment-resistant patients actually are going to have a response after even just a single 40-minute infusion. So that's pretty drastic. And the antidepressant effect can manifest within 2 hours, and 35% of the patients can maintain response for 7 days. And there's more than 50% improvement in symptoms, and there can be instant reversal of the suicidal thoughts, which is really powerful. We don't have anything that can drastically reduce suicidal thoughts. And so the fact that they act so rapidly really put pause on what's going on. If we used to think that it's going to take time for the antidepressants to work to promote changes, but apparently there's more to that story. So the fact that there's rapid changes in the synaptic function and the plasticity in the synapses, that makes you wonder, about the whole model of depression treatment. So we may be missing the boat. So this is a very interesting opportunity to see how else we can help people with depression. And so this is why I'm interested in ketamine. So I do have the background of being trained in psychiatry. So that's my first specialty. I worked for 11 years as a psychiatrist. Worked with a lot of veterans. Worked in a county emergency room. Worked in mental health clinics. So I've seen a lot of difficult cases, and definitely PTSD, one of the most difficult, most challenging conditions. And, so I'm astounded by what ketamine can do, because I could be doing psychotherapy with the same person for years and giving them medications, and I couldn't put a dent on their PTSD symptoms, because that wiring is set in. It's almost like it's etched in their brain. No matter what we do, no matter what we say, no matter what medications I give them, that hypervigilance, that stimulus response, this jacked up response is always there. So if ketamine is able to reverse that, sometimes within 1 session, 2 sessions, this is revolutionary. It's groundbreaking. So this is very inspiring. I also became interested in addiction medicine. So I got board certified also in addiction medicine. I was a medical director in a few rehab centers in Malibu. And from there, I got really interested in anti-aging and regenerative medicine. And because I realized the limitations of traditional medical model, whether or not it's addiction or for mental health treatments, you're not addressing the person from the ground up. You're only trying to target certain receptors in the brain, and you're missing the boat of what's going on in the whole body. So that is it's doing patients injustice. So anti-aging medicine, when you can reverse aging, reverse the decline that's associated with aging and all the inflammation, then you can actually get to the root causes of what's causing mental conditions. So inflammation actually is a huge part of what's triggering mental health issues. And so about personal challenges, we all have personal challenges. I think I grew up in a pretty healthy household, but with an overcritical mother. But we've all had challenges. But some people are genetically more prone to some mood issues. So since I was a teenager, I realized, okay, I have a periodic, little bit of, mild depression, and a little bit of anxiety. And from the anxiety, I realized, okay, if I eat some food, I'm going to feel a little better. So that led to this cascade of, eating, basically dysregulated eating. So sometimes I'm fine, and sometimes with hormone, in certain time of month, then it gets a lot worse. So these are some of my challenges, even during medical school, so it kind of comes and goes. I think it has to do with, my own health. So when I was looking at ketamine, I was like, okay, if it can have this kind of drastic benefit, if it can make my brain repair better, and if I can be more free, or even just be free of the carb cravings. At night, if I'm feeling a little anxious, if I eat some carbs, I feel better. But I don't want to do that, because then I have to, next day I have to starve myself to try to counteract the damage I did. So that was a vicious cycle. So I thought, well, ketamine helped with mood, help with addiction. I think that, there's some kind of dysregulation with eating disorder. Maybe it can help me. So that was part of my interest, to look into ketamine. And what I didn't realize was it was such a what's the word, mind-blowing experience. Uh, because usually I'm not very sensitive to medications and substances. I just figured I'm just going to sit there and just be maybe a little bit more relaxed. I didn't think much, is going to be, it's going to be that exciting. And then within 30 seconds, I was taken to a whole different realm. And I've never been able to break through this solid world right in front of me. And so I didn't know if there's anything beyond. So the fact that I was seeing something that's so complex, so profound, so drastic right in front of my eyes, and they keep changing and they keep evolving, the complexity of the imageries I was seeing. And of course, the feeling is pretty amazing. I've never been that free in my life. But the imagery were so complex. That's when I realized, okay, this is not a hallucination. Hallucination is, I think, it's almost disrespectful to, as a way of describing the experience. Hallucination, as a psychiatrist and board certified in psychiatry and neurology, hallucination is when you have this dysfunctional ability to perceive the environment. So you're faultily interpreting the environment. You're hallucinating. It's some kind of distortion. That is what's called entropy. So you're losing a complexity of your world, because that's a downward energy shift, because you're losing quality, right? It's a malfunction. But what I'm seeing is gaining complexity. So if you're gaining complexity, that means there's energy infused. Otherwise, you wouldn't have gained complexity. So that's something that's really drastic to me. That what I believe is that I'm seeing something that is not a distortion from my brain, but is a perception of another reality or another type of existence or existential phenomenon. So, I used to say that I'm not afraid of death. I've never, since I was 7, when I got over the fear, I'm not afraid of death. But after what I've experienced, what I have, what I've seen with my own eyes, I realized that I'm actually looking forward to death, because it's incredible. It's freeing. It's beautiful. It's powerful. So it's going to be a ride. It's going to be, a blast by the time it comes. So it gives you a whole other perspective. And I think that one is powerful, because I think as a physician, it's almost a taboo that we talk about spirituality. And that's an abomination, because that's part of human existence. And as physicians, we don't want to talk about, almost like you don't want to touch, spiritual. No, that's not part of medicine. No, new medicine is going to include spirituality, because we need to understand why that is part of this existence. It's probably as physical as everything we're observing, but it just, most people cannot perceive it. So when I was, under these kind of experiences, okay, there's no way I'm going to finish this in 5 minutes, because I'm just getting started. Yeah. Okay. So I just want to share my experience and let you know that, I think as physicians, we need to be more open-minded. And the fact that you are getting a new perspective is changing the way that I'm living this life. Because instead of thinking, this is the only life I have, I realize that I'm actually eternal, but this is one time I'm going to have. So this is joy, living as joy. This is one opportunity to live as joy. So I want to kind of impress upon you that this is your one opportunity to live as you, but you are going to go on. But this is a precious opportunity. So this is something I think it has changed me a lot. So I tried, the fact that I was deep into stem cell therapy, got me to start a clinical trial on stem cell therapy in traumatic brain injury. to see how effective it can be, and that requires SPECT brain imaging. So I did that one on myself just to see what process patients go through. And then I had a surprise finding, which is this is my brain card. So it just shows you what different areas of the brain, how they're affected. So this, you can't really see much, but here's the reading. First thing you see is that this is an abnormal brain scan. And it showed all these areas of hypoperfusions, right? Low blood perfusion. So including various cortical areas, so that's outer shell of your brain. Basically, every hemisphere or every region is defect. There's defect. Frontal, temporal, parietal, occipital, cerebellar, and then a subcortical region. There are also areas of hypoperfusion. And then amygdala, there's hyperperfusion, so too much, which means it's too activated. And so the conclusion from the scan reading is that this is a occult traumatic brain injury. So this is a big surprise to me because I have no recollection that I was ever hit on my head or fell in any way. Maybe there's a little bit of fall, but nothing severe. So I think a lot of us carry occult traumatic brain injury having no idea. So finding this out, I was on a mission to heal myself. So how did I heal? Attempt to heal my brain. First of all, I was excited about ketamine, and I know it has neuroregenerative properties. And then I also want to combine different modalities. And then I want to repeat brain scan in 2 months, which is never done because the location that did the SPECT scan actually only do repeat scan, on average about, in 6 months, but I wanted to do it in 2 months. So I just wanted to show you a little bit, quickly the neuroregenerative properties of ketamine. First of all, induces a sharp increase in BDNF, and that has been shown to be necessary for ketamine's antidepressant effect. And then also, ketamine can cause synaptic increase of BDNF, and that eventually led to increased synaptic efficiency. And ketamine also can activate mTOR pathway, which is very famous now for longevity, and that leads to a cascade event that can increase dendritic spine and synaptic strength in the prefrontal cortex. So here's another article talking about neuroprotective effect of ketamine in traumatic brain injury, in subarachnoid hemorrhage, in stroke, and other neurological diseases because it inhibits these neuronal discharge across all these injury modalities. And a single dose of ketamine can mitigate post-operative cognitive dysfunction, so after operation, and also can prevent stress-induced cognitive inflexibility. And it can also provide neuroprotective function by relieving pain and inhibiting inflammation. So that also, we're a holistic being, the pain can send whole other types of cascade. And of course, inflammation is the basis of most diseases. And some other example of neuroregenerative capabilities, including increasing hippocampal cell proliferation and by then improving behavioral function after injury. And it can induce neural stem cell proliferation after short exposure. And it can be a novel mechanism for its antidepressant effect, which is by activating IGF-2 receptors, and that can promote neurogenesis and eventually leading to proliferation of neuronal progenitor cells. So these are just some of the basics. And so what I did was that I used various modalities because I believe in combining different treatments, including energy therapy, including heightened blood perfusion, and how I can even amplify the benefits of ketamine. So red light, helmet, full body light, and PMF, inversion table, and infrared sauna. So I talked about that in panel discussion. So this is my clinic. This is the room where we have a PMF mat, and we have a full body light treatment, which gives you a completely different experience. And this is the helmet that we can use to help with brain repair. And this is the infrared sauna, which the infrared rate is actually very healing. And of course, infrared sauna helps you with detoxification. So we also do that. This is through an intramuscular injection, and patient has an incredible experience. They're completely different from the other type of light therapy. And then inversion table, that's a whole other story. But so I incorporated various modalities, and then 2 months later, here's the result. Cortical structures, we talked about various areas of hypoperfusion. So you could see, so this is exactly 2 months later, that, in frontal lobe, in the, other, the 5 areas of hypoperfusion drastically improved or not noticeable. And the cortical area also resolved, the hypoperfusion was resolved, and the increase, the hyperperfusion in amygdala also is not, they couldn't really see it on the scan. So that's pretty much it. It's a very quick overview. So I do combine these modalities in the clinic because I do believe that we are energy beings, and energy and light therapy is a powerful way to energize your cells, and has much more profound effect than we previously knew. So by combining that with ketamine treatment, I do think that it accelerated the healing of my brain. And so I just want to share that with you. This is the first time I ever shared that in public. And thank you for listening to my story. And if you have any questions. Yes, please. Oh, it's in Chatsworth, California. So it's right here in the valley. Yeah, we're close. And we do a lot of interesting things, including stem cell therapy. Sometimes I combine ketamine therapy with stem cell therapy because, ketamine can, enhance your, change your brain waves, change your brain pattern, your connectivity, increase the growth factors in your brain. And stem cells can also, enhance brain-derived neurotropic factors, can also, break down scar tissue, reduce inflammation, promote regeneration. So I do believe the two can be very synergistic. So they can try to accomplish similar things, but through different routes, so they can come together. No more questions? Oh, yes. If you do too much and too frequently, I think that is a possibility. But at the dose and frequency that we're doing, I don't think that's a concern. I would say, because initially the dose recommendation is 6 sessions, probably within the first 2 to 3 weeks. I stretch it out to 6 weeks because I think people can do very well once a week. And if you do maintenance, usually it's no more than once a month. Some people may want to do it just once a year, if they feel the need to kind of reground and get their brain to come to a fresh new perspective, or kind of this revamp. That is, so people shouldn't do it probably as a maintenance more than once a month. Probably emotionally more balanced, and some of my, I think the cerebellar lesion probably caused, some of, I don't notice very much unless, I'm dancing, I'm, making a turn, that it could affect my balance. I think that was improved. So that's just a couple things that I noticed. The brain scan is called SPECT scans. It's more a functional scan because they inject a radioactive dye into your blood, and then they track to see what your glucose metabolism is. So that's why they can detect high blood flow, low blood flow, where you can't see in normal MRI. And because it gives you a very steady, very smooth experience. But because I'm combining with different modalities, once I understand how a person responds to intravenous, then I have a much better idea of the dosing and just how the reactions are. And then I can give them intramuscular, so we can incorporate with all these other modalities. Yeah, I usually pretty much reproduce the state they had when they were doing the IV. Yes, everyone is different, definitely, but generally it's dissociative. Yeah, some people it's a little milder, And some people have, just very, very drastic experience. Yeah, that's what we do. So that's usually combined with intramuscular injections. So, and what's fascinating is when you are under ketamine, you're exquisitely sensitive to energy. So let's say the red light helmet. I can put it on my head and I feel nothing except for a little warmth. So I was like, well, I don't know if this thing is working, but if you're under ketamine, you can feel, with no doubt that there's energy going through your brain that's doing something. It's pretty interesting. So all these different energy waves will give you a completely different experience. Sometimes it is the first exposure. I think it's a little drastic for some people. It's probably better to try it out first. Especially inversion table. I think that can be drastic for someone. Yeah, so I definitely recommend, I don't recommend to do it the first time you come to the office because if a person has no experience with ketamine and you put a big dose right into their muscles, they could, have a reaction they don't like, and you can't take it out. You can't stop it. You can't do anything for the whole thing to run its course. And you have less control over how fast the muscles can absorb the medicine into the bloodstream. So some people with more sluggish blood perfusion or metabolism, it can take them a very long time, very slow, long, painful experience. Whereas I've had a patient who it was like that. It would take her over an hour and a half to have a whole experience. But after of course, we do all these other things, stem cell therapy, exosomes, and other MAE therapy, a lot of other treatments, she was improved, and she could finish the session within half an hour. So it's drastic. It's the same IM injection, but drastically different timeline. So it's because her own system is allowing the absorption to be much more efficient. So, but generally the injection for most people will last between 20 to 30 minutes, whereas when you do IV infusion, you can do it as long as you want. You can do it 6-8 hours if you want, but we generally do it between 1 to 3 hours. Yes, so I think that's it. Thank you very much.